With Christmas now just 2 days away, the COVID-19 situation is continuing to get worse as testing capacity becomes overwhelmed. On Thursday, Ontario recorded a new single-day high for COVID-19 infections, with 5,790 new cases being reported in the province. Out of that number, 486 cases were in Ottawa, a new record high for the city, and a number which in reality could be much higher. Ottawa's top doctor, Vera Etches, has said that drop-ins at testing centres will no longer be accepted, and even those showing symptoms of having the virus may not be able to get a test. While they are working at ramping up testing supply, Etches says anyone showing symptoms, regardless of vaccination status, must isolate alongside members of their household for 10 days, even if they can't access testing. I asked Ottawa's top doc about the daily COVID numbers and how they compare to reality. In Ottawa, testing capacity isn't there. People are being told to self-isolate even if they're showing the slightest possible COVID-19 symptoms. Proper contact tracing can't be done due to the demand. I'm seeing more and more people post on social media that they've tested positive for the virus despite being extremely careful and following all the proper procedures and guidelines. They're also fully vaccinated. So in reality, the COVID-19 numbers here in Ottawa can be much larger than what's being reported. Is that a concern for you?
Oh, I have no doubt that we have widespread transmission of COVID in Ottawa, much beyond what we are detecting. Absolutely. It's why we needed the public health measures that are going to restrict capacity, that are sending the message that the smaller the gatherings, the better. Now is the time, to limit our contacts. I'm thankful that people are doing this. But yes, these are the prevention measures that need to be in place. That we're monitoring, are they strong enough? We'll continue to look at, the pressure on our hospital, I think, is a key indicator. Hospitalizations has always been a key indicator. It's not as affected by, people don't pretend to go to the hospital. They really have severe illness. They're tested when people go to the hospital with respiratory illness. So this is a marker and something we're watching. The percent of people testing positive is so high, we know that not everyone's presenting for testing. So that shows us also there is a lot of COVID in the community.
Last weekend, Ontario enacted new restrictions which would limit capacity to 50% in almost all settings, including restaurants, bars, gyms, movie theaters, and personal care settings, among others. Ontario's medical officer of health said at the time that while these new measures would not stop Omicron from spreading, it could slow the pace. This as new modeling suggests Ontario could reach 10,000 new daily infections by New Year's Eve. Quebec has already enacted stricter measures as they reach over 9,000 new cases per day. Bars, gyms, and schools in that province have already closed, and gathering limits for private gatherings will be dropped to 6 people by Boxing Day. Now, as COVID-19 cases continue to climb in Ottawa, Etches isn't ruling out another round of tougher restrictions. Are even more restrictions needed to help limit close contacts, possibly closing down all non-essential businesses as case counts here in the city of Ottawa rise to levels we've never seen before?
If we look around the world, I think some places are needing to go further, and that is a possibility. I'm sure what we're all watching again is the hospitalizations in terms of how much severe illness is falling, and we want to act sooner rather than later. If we start to see the hospitalizations growing, we know that things can change quickly. We're really looking at this day by day, every day.
An outbreak in Ottawa's paramedic services has been linked to at least 36 COVID-19 cases and over 100 close contacts, including among patients. The outbreak has been linked to an off-duty social event which was not organized by the paramedic unit. Mayor Jim Watson, who is currently isolating at home after contracting the virus himself, says he's disappointed by the situation.
Regarding the recent news about the outbreak among our paramedic service, I found the news to be extremely disappointing and frustrating. I've always considered our paramedics to be some of the best in the country, and they hold one of the most honorable professions. The speed and ease at which this virus spread through the paramedic service shows just how tenacious and damaging the virus can be. Ottawa Paramedic Service has instituted enhanced infection control measures and is working closely with OPH to identify close contacts.
With Christmas now over, Ottawa is reporting upwards of 1,000 new COVID-19 infections per day, a number which in reality is most likely much higher. With strains still on the testing system, many people who are showing symptoms of having COVID-19 simply can't find a test, but must still isolate for 10 days. Now, many of those are infections which will never be reported in the daily case count. Now, it's still unclear whether or not more restrictions will be coming in the days or weeks ahead, but one thing's for certain, more and more people here within the city of Ottawa are testing positive for COVID-19. Charlie Sinatu, IN News, Ottawa.